Direct access means giving patients the option to see a dental care professional without having first seen a dentist. The GDC passed this policy decision in March 2013, and it came into full effect on the 1st of May. So what does this actually mean? Essentially, dental hygienists and therapists can carry out pretty much their full scope of practice without needing a prescription from a dentist. Providing treatment in this way is an option for DCPs, and dentists shouldn't expect DCPs to see patients direct if they don't feel confident to do so. Those who wish to provide treatment direct to patients must be sure that they are competent. DCPs practicing under direct access should work within their scope of practice and should refer when necessary. If a patient refuses referral to a dentist, the possible consequences of this should be explained and a note of the discussion made in the patient's records. The advantages behind this change include the fact that it helps remove the barriers to patients when accessing dental care. Patients are given the choice and also creates care pathways into the practice for previous non-attendees. Some argue that as much of the assessment process is carried out by the DCP, the dentist then has more time to focus on high-end restorative needs. It also utilises a skill mix within the team, promoting collaborative practice. So, is there anything that's not covered? Well, yes, tooth whitening and Botox treatment still require the prescription of a dentist. Local anaesthesia requires either a prescription or a patient group direction. These may be seen as disadvantages. Some also feel that the laws are just not actually ready for direct access. You're probably now thinking, will this reduce the need for us dentists? Again, there are mixed views on this. Dentists will always be a vital part of the team, and there's a whole range of complex conditions which dentists will still be required to diagnose and treat. A patient still has a choice to see who they want to. The role of dentists may, however, change depending on the setting of a dentist they work in, the location, how many DCPs practice nearby, and any referral arrangements. There may be an increase in requests for second opinions, prescription requirements, or direct referrals due to treatment requirements. So you can probably start to realise that the type of work that general dentists will be doing may change. Who supports this? The GDC, the Department of Health, the British Dental Health Foundation, dental trade, and indemnity companies are all for direct access. The BDA are not currently in favour of this change and believe the change to the skill mix is not a short-term project, but it could evolve as long as the economic and operational structures are favourable. On the whole, dentists seem to have mixed feelings.